Because it's a state mandate, healthcare employers risk losing facility licenses if employees aren't compliant. So those who hold out may soon lose their job. But it all varies depending on where they work.
We should have a right to choose.
It was 2 weeks ago when protesters took to the state capitol speaking out against the state's vaccine mandate for healthcare workers. Sacramento nurse Carly Rinaldi had been vaccinated, but she said forcing it didn't sit well with her.
I'm not okay with my friends and colleagues needing to make a choice or lose their job. I'm not comfortable with going to work with whatever reduction of workforce is not going to come to work with me after the mandate is implemented.
The September 30th deadline to get vaccinated or get an exemption is now here, but California state epidemiologist Dr. Erica Pan says she is not expecting shortages when it comes to unvaccinated healthcare workers.
Less than 1% of people are not getting vaccinated. So it's actually been a small number that don't go ahead and get that full vaccination.
ABC 10 checked with major healthcare systems in the region. Sutter Health, Kaiser Permanente, Dignity Health, and UC Davis Health all reported well over 90% of their workforces already vaccinated. Dr. Pond says it'll be up to healthcare employers to decide what to do about employees who aren't in compliance. Kaiser and Sutter all said that employees who are not will be placed on unpaid administrative leave starting October 1st. And if employees remain out of compliance, Sutter says they're subject to termination by October 15th. Kaiser says by December 1st. Dignity Health also said any non-compliant workers will face the same process, but did not provide a timeline.
First of all, as healthcare workers, I think it is part of our obligation to make sure we are doing all we can to take care of our patients.
And we also spoke to the Northern California Hospital Council, which says the mandate is essential in the fight against COVID-19, and adding it'll be hard to predict how this will all play out, and it's possible that some workers may choose to resign rather than get their shots.